The shutdown started 1st of October. The Democrats refused to pass a Republican short-term funding bill that excluded extensions for the Affordable Care Act subsidies. Those subsidies, they say, help 24 million Americans affording health insurance. Republicans arguing that Democrats want to fund health care for undocumented immigrants. That has been fact-checked, and it is false. Meanwhile, SNAP benefits have lapsed, federal workers are furloughed, and air traffic delays are mounting. Joining us right now is the executive director of the Arizona Public Health Association, Will Humble. Will, it is an honor to have you on the program once again, my friend. We always look forward to being able to catch up with you. When it comes to these subsidies, and I know that the open enrollment period is happening right now for Affordable Care Act, how many Arizonans are we thinking are affected by this specifically?
So there's 400,000 people in Arizona that get their insurance from the marketplace, but not 400,000 of them, not all of them, are wrapped up into this debate, because people who make over 415% of poverty, that's for a single person, that's $65,000. People that make that much aren't getting any subsidy anyway. So we're probably talking about something on the order of 330,000 people in Arizona.
Okay, so
still a pretty big number.
Yeah. So 330,000 that are facing this. When we talk about the people that are facing it, I've heard. I think President Trump said, "Well, this is just Democrats that are going to be suffering from this." But then I've seen stats that say, "No, this is all kinds of people from all over the political spectrum, from single moms to elderly veterans." Do we have an idea of what the typical SNAP recipient looks like?
You talking about SNAP or the? I'm sorry.
The marketplace. Sorry, I apologize. Thank you. Yeah.
Yeah. So there's no typical anything in this life, really.
Yeah.
But it's anybody who doesn't get health insurance through their job, that also doesn't qualify for Medicaid. In our state, that's access. Who doesn't qualify for Medicare. That's the group of people. So it's everything from, say, for example, my daughter, who's a graphic designer. She's a sole proprietor. She's running her own business. She gets marketplace health insurance. To a rancher, in Springerville. So it's the whole gamut. So no, it's not party affiliated. In fact, there's actually this is from the Kaiser Family Foundation. Did some research on it, and there's a higher per capita participation in marketplace insurance in red states than in blue states.
Oh, interesting.
Talking with Will Humble. He's the Arizona Public Health Association Executive Director. And Will, you just said it. There's no typical anything when it comes to this. So what advice do you have for those who are enrolled in healthcare through the ACA marketplace and have been getting subsidies? What should they do since it's open enrollment now?
Great question. The number one thing is and you guys were talking about this a minute ago about doing the shopping part of this. Do your shopping now, but don't buy anything now. The reason is you don't know what the price is going to actually be. What's the nut to crack every month? You're not going to know that until Congress resolves this issue about, are they going to extend the enhanced credits or not? So you think about just on practical terms, you go to the marketplace insurance now for open enrollment. It's for January coverage. The enrollment period goes through December 15th. So I would urge people to start doing their homework now. Do the things like I don't know if it was Chris or Joe, one of you were talking about, like looking at who's in your, like looking at the different plans, looking what doctors, your primary care providers are in which plan, look at what the coverage levels are, the deductibles, do your research so that you have an idea about what plan you want to buy, but don't bite the bullet. Don't buy it until you know what your what your tax credit's going to be. You may make a big mistake. For example, you might be on a gold plan right now and you do your shopping right now. You'd say, geez, I can't afford that. I'm going to go for this crappy bronze plan, and then let's say the traffic controllers strike at Thanksgiving and everything gets resolved, and then you're like, oh man, I bought this bronze plan and now I get the enhanced tax credit. I should have bought that gold plan, so that's why it's a mistake for people to buy anything now, but they should definitely start their shopping because, as you mentioned, it's not like going to Costco and picking out, something there. It's a complicated thing to buy.
Yeah, Will Humble, executive director of the Arizona Public Health Association. Are we kind of gambling with the clock, though? How long does open enrollment last? And is it likely that the government's shutdown could last even longer than the open enrollment period?
I don't think it's likely that the shutdown's going to last that long. I think we'll know ahead of that. To answer your question, for January 1st coverage, the open enrollment ends December 15th. So that's a little over,
like 6 weeks.
Month.
Yeah. Okay.
Yeah.
All right.
And then for February coverage, it's, up until January 15th or so. Depends on when you want your insurance to start, but I wouldn't buy anything right now until you know what the price is going to be. Having said that, if you're making over $65,000 a year, you're not going to get any help anyway as a single person. So for those folks, you ought to just do your research and buy what you're going to buy.
Why is there such a fuss, Will, with I mean, the subsidies that we're talking about are the ones that have been around since the pandemic. So really what we're talking about is going back to the level of subsidies that were available prior to the pandemic, if I understand things correctly. And please, if I'm misunderstanding it, correct me on that. But why is there such a fuss then over this? Have we become that dependent on that money so quickly?
Essentially, what this enhanced tax credit does is reduce the percentage of your income that goes to your health insurance. So, for example, for a person making $45,000 a year, under the old system, you were capped at 9.6% of your income. That's $4,300 a year. The system with the enhanced credit is 5.5%. So that's $2,400. That's a difference of almost $2,000 a year. And so that's the answer to your question.
Okay.
Like, who wants to throw $2,000 out the window when they don't have to? The second part of I think, honestly, the second answer to your question is that, when you give somebody something that they like and then you take it away, they get pissed.
Yeah.
But if you don't give it to them in the first place, they're not mad. Yeah. It's like the vouchers, the school vouchers, like when people the homeschoolers didn't have the vouchers, they did their stuff. They weren't unhappy. Now they're getting the vouchers. You try to take that away, that's nuclear war.
Yeah. Yeah. And I would say the same thing about the tax cuts, right? We had the tax cuts in the first Trump administration, right, and then those expired, but they wanted to have them extended because if you don't, my God, it's going to be a nuclear winter all of a sudden if people have to start paying the taxes.
It looks like a tax increase when in reality you went back to the way it used to be.
All right.
So it's human perception of the aversion to loss is what it's called in psychology.
Will Humble, the executive director of the Arizona Public Health Association. Will, thank you so much for trying to break this down a little bit for us and provide some clarity. We appreciate it.
Thanks for watching The Chris and Joe Show. Click to see more from Chris and Joe and tap the button in the middle to subscribe to KTAR News.